Well, gun violence has an impact on mental health. Already, more than 30 mass shootings have unfolded in the U.S., including at least 2 right here in the Bay Area. Joining us live now to talk about ways we can care for our mental wellness during these tough times is Nicole Ibarra, Area Director of Behavioral Health with Kaiser. Thank you so much, Nicole, for being here with us. We appreciate it.
Thank you so much for having me. It's such an important topic, so I'm really happy to be here today.
Yeah, and I understand that this might also feel very personal to you. You do a lot of therapy in your day-to-day work. You work with a lot of patients, and also you're a resident of Half Moon Bay. The most recent shooting happened not too far away from where you live.
Yeah, very close to where I live. And of course, all of the mass shootings, hit us really hard. This one, of course, was a little bit more personal. But watching the way that the community has really come together has been incredible. But it's been very painful for the community. And as you know, a lot of other things have happened the past couple months. And so the community is really wrapping themselves around each other right now, but it's been very hard.
Yeah, and the violence can really, and these incidents can really feel very relentless. How can violence like this affect people, even if their loved ones or friends aren't necessarily in that direct line of gunfire?
Absolutely. Trauma is complicated. There's trauma for the ones who experience it firsthand, but there's also vicarious trauma as well for first responders, for friends and family. There's people who've had a lot of their own personal trauma, and so this can trigger a lot of their pain and things that they've been through. And so it's very complicated. But I think, there's different coping skills for those who have experienced it themselves directly and those who are just, in touch with it through the community that they live in and what they're seeing on a daily basis happen.
And what do you recommend that, some steps that people can take if they're feeling anxious or down because of the recent headlines?
Yeah, I think I had a professor in graduate school who's incredible. And a tool that she taught me has really stayed with me, which is the 6 steps to feelings. So what she mentioned was when you're having an intense feeling, right? And this is a feeling where you can tolerate it to some degree because there's some feelings that we have associated with trauma when we may go outside of the window of tolerance and have the thinking part of our brain shut off. The amygdala. So if we are in a place where we can tolerate to some degree what's happening, even if it's really painful, there's steps that we can take. So one is just facing the fact that you're having a feeling and just having some compassion around the fact that this is what your experience is. And then after you face it, you allow yourself the opportunity to feel it, to have compassion for your feelings, to just let the feelings come out. And after that, finding a way to discharge the feelings outside of your body, outside of yourself, whether that's through writing, through crying, through talking to a friend, exercise, sweating. And after you discharge those feelings, then you're gonna think about what it is that you need. What do you need to feel safe? What do you need to feel kind of connected back to your experience? And then you're gonna make a decision. So maybe that is getting involved with gun violence in the community. Maybe that is outreaching to a friend and asking for help or exploring mental health options for yourself. And then you're gonna decide and you're gonna follow through. So you're gonna act it. So those 6 steps to feelings I find to be really helpful, and I utilize them in my own life on a day-to-day basis.
Yeah, some great tips there. And a question that has come up a lot as well, and I hear this from parents especially, is what kind of conversations can they be having with their young children or their teenagers when it comes to violence that's happening in the community?
Yeah, that's a really tough thing to think about with young children. I have young children myself. So what I've found is that children feel safe when they can actually talk about the things that are making them feel unsafe. So if something's scary, they want to be able to talk about it, and that in itself can really help. Oftentimes, last night my son he had a nightmare at like 2 in the morning.
Oh.
And he called me into his room and he just wanted to tell me about the nightmare. He wanted to tell me about the monster. I gave him a couple scratches and he went back to sleep. So obviously it's different with gun violence, but I think just allowing your children the space to talk about what it is that they know and getting really curious about what they know, because we don't actually know what they're hearing at school or from their peers. And so just offering that open space for them to talk about it, and then of course at a very age-appropriate level, being able to offer them different tools and really assuring them that they are safe, and there's many adults in their life that want to help preserve and keep their safety. and just letting them know bad things do happen in this world, and it can be really scary, and allowing them to be scared too and be in touch with their emotions. Because a lot of the times I think, we want to just kind of take care of it in that moment, but there may be some things that really need to come out, and we need to provide a safe space for them to just kind of unpack it.
Yeah. And what are some resources that people can take advantage of today if they might be struggling a little bit?
Absolutely. So, mental health is equally important as taking care of your physical health, right? And so even if in the moment you're feeling like you're pretty stable and you're okay, I think it's really important to know what resources are available to you, right? So understanding where you can go if you're having a crisis, or if your loved one is having a crisis, knowing what phone numbers to call, knowing how to reach out, knowing how to get that access to care. At Kaiser Permanente, we're working daily on knocking down all of the barriers and making sure that access to care is available right away. And so just being able to pick up the phone, either for yourself or for a loved one, and reach out and say, I need help, I'm not feeling okay. And realizing that that's okay, and that's actually taking care of yourself in that moment.
And would you, a 988 would be one of those potential options that
Absolutely.
people can take advantage of?
Absolutely. Knowing where your closest hospital is, right? If you may need to check yourself in for an involuntary or voluntary hold, which will then connect you to more resources. Right? There's just so much going on in the world today that sometimes we are running around day to day just kind of thinking, okay, I'm just gonna, make it through and grin and bear it. But there's absolutely no shame in getting help, and know that there's a lot of professionals out there who are ready to support.
All right, Nicole Ibarra, Area Director of Behavioral Health with Kaiser. Thank you so much for your work and for your time and your insight this morning. We very much appreciate it.
Absolutely. Thank you so much.
All right, we'll be right back.